Begin. Good evening, fellow Toastmasters. I'm going to be talking to you today about some of my work projects, and one in particular has to do with data sharing. And so I'm going to be telling you a little bit about the importance of sharing data that result from research funded by the National Institutes of Health. This is your nation's agency that funds medical research. I'm starting off with this slide here because I just want to give an idea, and please ignore all the data, and I'm going to just tell you what you need to know about this slide. This is to show how bad the situation can be and has been. Data sharing, the importance of data sharing, I'm going to get into in a second, but you'll see from these studies that when researchers have tried to access data from published studies, they've had a really hard time doing so. That's what this slide is designed to show you. Now, notoriously, when research papers say, contact me, the author, I'll give you my data, then you can evaluate my study, validate it, replicate it, whatever you want to do. People have a really hard time getting those data. You can see there's really terrible figures here. For example, the first one, which is not the worst one, a little less than 40% data requests were successful. Other times it's 6.8% of the time, 3.3% of the time. It's pretty bad. So this is just to show you how bad it's been. Now for the really important piece. Why is it important that NIH ensures the sharing of data from the research we fund, or the planning for the sharing of those data? For example, it advances rigorous and reproducible research. When data are shared, it enables validation of those research results. Other people can come in and make sure that those findings were accurate. It makes high-value data sets accessible to other researchers for other uses. It accelerates future research directions. So maybe reusing those data takes it in a whole different direction that wasn't even intended by the initial study. It increases opportunities for citation and collaboration, which are key to the scientific process. In addition, it promotes public trust in research. People tend to trust things more when they're transparent. It fosters transparency and accountability, demonstrates how its taxpayer funds are stewarded. Oh, excuse me. And it maximizes, for those studies that involve human participants in research, it maximizes their contributions to that research. And it also supports appropriate protections for those research participants' data. Again, as I mentioned, it is a matter of trust. This slide shows the percentage of US adults, and for each of these factors on the left, when they hear each of those things, do they trust the research more or less? And so you can see that the most important factor was when data are openly available to the public. Of these 4 topics, that is the one that makes them trust the research the most, when the data are openly available to the public. In order to address this, NIH has gone through an iterative policy development process over many years, because every time we issue a policy, it affects what those who we fund have to do. And that's really important. It's extra burden, it's extra work on their part, extra thinking and processing and paperwork. And so it's a long process. So for example, we started in 2016 with RFI, stands for Request for Information. That's when we go out to the public and get their input. So in 2016, we had an RFI on strategies on data management, sharing, and citation. 2 years later, we had another one on proposed provisions for a draft policy. This is where we asked the public, what do you think should go into a data management and sharing policy? What about these ideas? In 2019, we went out with our actual draft policy and related guidance documents. We released our policy in 2020, and the policy became effective it was about 2.5 years later. And we also went through the tribal consultation process. This is an elaborate process that involves input from tribal communities and tribal nations. And we received input from the Health and Human Services Secretary's Advisory Committee for Human Research Protections and other agencies. What are the core pieces of our policy for data management and sharing? Number 1 is submission of a data management and sharing plan, which outlines how, where, and when people propose to share their data, and then compliance with that plan. So these are really the 2 requirements. Now, as far as the plan is concerned, we emphasize sharing through established repositories, because as you saw at the beginning, when people say, contact me, trust me, I'll give you those data, it doesn't work out so well. Plans are assessed by staff at the NIH. And non-compliance with your plan can affect future funding. The policy was effective in early 2023, and this replaced a long-standing 20 years earlier data sharing policy that was not comprehensive. This policy only applied to very large NIH awards. So the new policy that replaced it is comprehensive across all of our awards that fund research. We have a number of materials to help people understand the policy, supplemental information documents, which are like guidance and what people need to know about the policy. So what goes into a data management and sharing plan, the elements of a plan, allowable costs, what kind of costs can they recover for these data management and sharing efforts? Selecting a repository for data resulting from NIH-supported research. So how do people choose where to put their data? What makes a good repository? And this is complementary to a White House version of the same document that was published that's interagency. Protecting privacy when sharing human research participant data. And we have another one on responsible management and sharing of American Indian and Alaska Native participant data. And that relates, as I mentioned, to the tribal consultation process that we went through. We have a number of FAQs, or frequently asked questions, on our website. And the newest ones have to do with our small business awards. Those are our SBIR and STTRs, or kind of shorthand for our small business awards. Those are our newest. And we also have one on patents that I didn't mention here. And we also have a number of sample data management and sharing plans that people can look through that have been carefully prepared to give people an idea of what a good plan looks like. We have a lot of work to do. So we are practicing a very generous philosophy here. We're all learning together. So we're not kind of out to ding anybody or get anybody if they don't kind of do things perfectly. But the idea is that we want to learn together. And, we know at the beginning things may not be ideal. And we need time to identify best practices. And we're finalizing updates related to the RPPR, which is just shorthand for annual reporting processes. We want to learn about challenges for applicants and also long-term evaluation of how data are shared and used. Thank you very much.